I'm Professor Lorna Moxham and I'm the Living Well Longer theme leader within the Global Challenges program at the University of Wollongong. Today we're here talking about caring for the incarcerated, which is exploring 200 years of history within the New South Wales Prison Medical Service. When the Caring for the Incarcerated team approached the Global Challenges program in 2015 for seed funding, we knew this project would make an impact. It brings together expertise from humanities, public health, history, including Australian Indigenous history, and medicine in a custodial setting, among quite a few others. An interdisciplinary powerhouse to help us explore lessons learned over the last 200 years of the New South Wales Prison Medical Service, giving us a very different perspective to prisoner health. Today I will be speaking to researchers, Associate Professor Luella McCarthy and Dr. Catherine Weston. Their Global Challenges research project unveils how historical forces have come into play in today's delivery of healthcare within prisons and has resulted in an exhibition that will travel Australia that explores 200 years of history within the New South Wales Prison Medical Service. Ultimately, the impact of this research will have a direct result on inmates themselves, along with their families and the community upon release, and helps to inform current practice and future needs. How did this project come together?
Well, it had a very interesting birth. I worked with Justice Health for a number of years. I'm involved with medical education. We're in the graduate medical school here, but it was about putting medical students in prison. Bit of a joke. In order to learn not only about prisoners and prisoner health needs, but also about social stigma, because that's a really important issue for medical students to learn about, and the impact of stigma on health. The fellow who is now Executive Medical Director of Justice Health is Stephen Hampton, and Stephen is both passionate about medical education, but also was intrigued by the history of his own organisation. As most of us know, Australia, or at least New South Wales, began as a convict settlement. So Stephen's interest was about the connection between what they do and the original white settlement / invasion of Australia, and whether there was whether they were connected, whether there was some longer history here that could be investigated, because he could see that doing that would help inform what they're doing by better understanding how they came to be what they are. One of the things, I guess, to keep in mind about Justice Health and the service history that we're investigating is that Justice Health itself is quite young. It's only 25 years old, and it emerged out of these historical processes that we're investigating.
So history informing current practice?
Absolutely.
Yeah. Can you tell me more about the interdisciplinary nature of your team and how the differing perspectives have allowed you to get to the heart of prisoner health?
Well, I'll start and then pass over to Kath, because one of the, interesting, exciting components of the project is the way we've brought together those variety of perspectives on what we're doing. So I'm a historian by training and a historian of medicine by choice, and bringing that notion of how medical practice itself has changed over time is one component. But of course, one of the things about prison medical services and prison health more generally is how it relates to public health. And so Kath's background and expertise in public health has brought that different perspective.
So my interest particularly is in outbreaks and diseases that affect the population, if you like, which is, I guess, the core of public health. And so my interest in the history of smallpox and tuberculosis and influenza outbreaks over time is directly relevant to what's happening in situations where people are put together, such as in prisons. And then everything that relates to population health is relevant in a prison setting, including socioeconomic determinants of health. And we know that much of the prison population is drawn from those at the lower end of the socioeconomic grade, if you like, and so it's very important for us to understand their needs and their health needs. And as Luella said previously, that Justice Health itself is only about 25 years old, but there has been caring for the health of people for a long time since then. But one of the really telling things that about 15 years ago, Justice Health stopped referring to the people they care for as prisoners and start talking to them about them as patients. So that's a great big change.
Absolutely. So given the interdisciplinary nature of the project, what can you tell us about the key learnings so far?
Well, we'd have to start with the initial question that Stephen raised, which is about the connection between what happens now and what happened in 1788 when and before, when the settlement, the colony was established. One of the, I guess, key issues of the colonial experience or the convict experience was the ship was the transport over. It was big, it was scary, and it was potentially extremely dangerous. One of the initiatives that were taken in getting the convicts to Australia was having ship surgeons. The ship surgeons took on a variety of roles in the New South Wales convict service, and we can pretty confidently say that there is a direct genealogy. So we can go back through the various permutations that the Prison Medical Service has taken on back to that convict medical service. And one of the strands throughout the service has been, I guess, to not put too fine a point on it, the reluctance of people to be imprisoned. And imprisonment has led to a variety of responses. One of the most dramatic, and as we've detailed in one of the panels here, has been riots. Prison riots have been a constant through the prison services history, probably not only in Australia but throughout the world. In response to those riots has resulted in inquiries and investigations into the conditions that prisoners have lived in and under. And one of the most dramatic was in 1975, so relatively recent history, was across the state. It was quite interesting that there were a number of prisons that spontaneously almost erupted into riot. But the one we seem to know best is the Bathurst, because the riot ended up burning down the prison. The local member for the Illawarra, interestingly enough, George Peterson, was an MLA who saw this as not simply a problem of prisons, but specifically in the way prisons were currently then being run. So he was a push behind getting an inquiry up and running, which resulted in the Nagel inquiry, which is of course very important and quite well known. One of the responses from the Nagel inquiry, or one of the bits of evidence that they followed through on, was the kind of health conditions that prisoners were living under. And Bathurst was notoriously bad. There was no glass in the windows. And as with a number of prisons, there were no toilets. They were, you could see the influence of history because it was there in front of you. So one of the responses was the creation of the Justice Health Medical Service. And this is internationally important because doctors have a responsibility to the patient. They take an oath, the Hippocratic Oath, which is, the patient's interests have to come first. Working in a prison is a kind of conflict for them, because prison's first responsibility is about maintaining order, control, all of those things which are counter almost to the responsibilities of a medical practitioner. What Justice Health has been able to do as a government response is to separate those two roles. So as Kath says, there's now the people are called patients. The Justice Health refers to its patients, not prisoners. So there's a clear differentiation. This is now seen around the world as a very sensible response. So Justice Health is separate from the corrective services. It's part of the public health system, which is, as Kath says, reflects that it's a public health issue. But it more deeper than that, it reflects that that medical practitioners have a responsibility at that level to their individual patients.
Examining that tension sounds really interesting.
Yes.
Having a look around this exhibition, which absolutely everybody should come and have a look at, you've clearly unearthed some interesting things. Have you found anything that's been really unexpected?
The diversity is probably the most unexpected thing. I think when we first were talking about putting the exhibition together, we knew we were going to be looking at mental health, disease outbreaks and legislation. But then from that, we've been able to find information about how much doctors were paid to come in and act as surgeons and so on in the hospitals, in the prisons rather. And also, there are multiple roles, so they might have been paid a little bit extra to be the vaccinator, a bit more to be the coroner, a bit more to be the surgeon. And so we've learnt a little bit about how the doctor got into the position of being the prison medical officer, and it was quite a sought after position because of the status, as well as it provided you with additional funds. So I guess that there's been some beautiful things. We've found the original plans of the Long Bay Jail Hospital, which are, we've displayed as well. Interesting things about when AIDS became a problem in the general community, but it was quite a challenge in the prison community, as you can imagine. With the fear that was in the general community, you can imagine being even enhanced in a population of people living quite close together and whose very actions as part of their daily life put them at risk. And so that's been something that we now have a way of extending and looking into that further. So the diversity of what we found has really opened many doors for us to know, to go down to find out even more. So lots of interesting things about how many people died of typhoid, which you might expect, but the modern history as well as the old history is just fascinating.
University of Wollongong and the Global Challenges program is really interested in supporting research that has a real world impact. What kind of impacts do you see that this project's going to have on public policy and on prisoner health?
There's literature that shows that respecting prisoners reduces the rate of recidivism, reoffending. And one of the best ways to show respect for prisoners is to provide them with the kind of healthcare that they need. And so having an understanding of the needs of the population of prisoners who enter prison, also their longer term needs, such as they're becoming dementia patients later in life, or being immobile, and not many prisons have lifts or elevators, if you like. So it will inform a way to look at the needs of the prison population and be able to respond to those needs. And the historical side of it, particularly if you look at mental health as an example, really does give you like a strong impetus to say, well, we don't actually want to do that. Again, we need to recognise all health, the global health, the physical health, mental health, the social health of prisoners that are incarcerated, and be able to recognise that is a definite need and that we do need to be able to respond to it. And as a leader globally, what's happening with the New South Wales prison system, it's only going to be helpful worldwide too.
And can I add to that, so that I think the impact is both internal and external. So we've had a lot of interest from the Justice Health group itself about the work we're doing and the way that will help them inform. So help the board make informed decisions based on historical precedent. But we think too that it's also externally important, because one of the big issues facing people who find themselves in prison for a variety of reasons is the stigma that's attached to them. So what Kath has been identifying is the way that there is a disproportionate representation in prison populations of people from low socioeconomic backgrounds. So asking the question, what's going on there? Why are there so many people unrepresentative? So of course, you know, one of the issues that comes up a lot is about Indigenous incarceration rates, which, as we all know, are grossly unrepresentative for the population. And there is a well-accepted rationale for that, which is institutional racism. So if we broaden that out to say, why is there so many people from low socioeconomic backgrounds being imprisoned, then we start to ask questions about the decisions that are being made at a variety of places that result in that. But the other side of that is about that stigma, is about the stigma that people come out of prisons with, and the difficulty that presents for them rejoining society or you know, getting their lives back. And we think that having something like this, people are intrigued by history. They're especially intrigued by prison history. You know, it's dark tourism is its formal name, and there are prisons throughout New South Wales and Australia which focus on the history of imprisonment in Australia, which is, I mean, it's not only an Australian thing, but it is particularly prevalent here. So we think that being able to become part of that and asking these questions, so presenting prisoners as people who may have been unlucky, who you know, from a variety, well, they're obviously unlucky from the socioeconomic data, but being unlucky in other ways as well, that this could be you, this could be any of us that end up like this. So it's not something particular about prisoners, you know, they are representative of all of us, and trying to help break down the stigma that people bear often for life afterwards.
And one of the really interesting components is the interdisciplinary nature of your team, and the project's going to enable you to examine this in so many different ways, wearing so many different lenses. So what are the future goals of the project?
I think just carrying on from what Luella just said there about Indigenous incarceration, we've teamed up with the Black Wallaby Writers group from Junee prison, and so we're looking at the ways that we can embrace the cultural side of or whatever needs are for that population in prison as well. So that's taking a direction that's directly related to a very overrepresented population in the prison system. We have a criminologist coming on board. We're looking also at the history of nursing within the prison system, and realise that that's something that we haven't got a lot of information about, and we're very keen to grow our collaborative network there through people who are interested and have some expertise in the history of nursing as well.
One of the, I guess, our institutional goals, there's been a lot of interest in the project, a lot of interest in the work, a lot of interest in participating in some ways. So our shorter term goal, although you know over the next couple of years, is to try and bring together all of the people who are interested and create a space where carceration, Kath's favourite word, forms the research focus. So whether it's from, as we should have said earlier, Justice Health is a shorthand name for the Justice Health and Forensic Mental Health Network. So mental health is clearly a big issue for prisons and for prisoners, and has been all along. And we have tried to document how interrelated both mental health, mental asylums, as they were called in the earlier times, and prisons, architecturally, structurally, and the programs played out in them bore so much relationship to each other that it can't be a coincidence. One of the changes over time that we've identified, most people are aware of the ruling or the verdict in a case of not guilty by virtue of insanity, so the insanity clause. That verdict, nevertheless, for many prisoners in New South Wales meant they went to prison anyway, but they were locked in different cells and often in isolation from other people, which is in itself not a great response. What we're looking to do is to create a space where we can bring together all the researchers who are interested in this field of work. So it's not simply about people imprisoned, it's also about the variety of forms that people can find themselves incarcerated. So of course the big one in Australia at the moment is refugees, but there are a variety of people who, through no fault of their own often, find themselves incarcerated in hospitals, although I'm sure hospitals wouldn't thank me for calling it incarceration, but who've lived a lot of their life in hospital. So we've met a lot of people who are interested in joining some sort of centre or research cluster, or, and not only in Australia, there's a number of international researchers who've also expressed a great deal of interest in joining us in looking at, I suppose, the contrasts and compare what's happening overseas and what has happened overseas. Not least, I would argue, but because of the unusual nature of the development of the prison medical service in New South Wales, it means that we probably have the oldest prison medical service in the world. So we think we have a lot to offer the world in terms of understanding how these services have developed.
And also in New South Wales itself, because if you look at the history of where the jails were built over time, it follows, I guess, the frontier mentality and the frontier development of the state too. And if you just bring it right back even to our own institution, that we have medical students and other students on placement in various rural and regional parts of New South Wales where there are prisons as well. And to go back to what Luella was saying, it's not just prison, but anywhere else where there's confinement, and it might be because of disability or refugee or asylum status as well, that it's really important for all our students in whatever faculties to have an understanding of the population that they might be serving in their professional capacities. And so we are very intending to take our exhibition to the rural and regional hubs where our medical students and our nursing students and other students are placed, so that it just brings a different perspective on that community that's there, which has a prison, directly into the learnings of the students while they're on site.
As the Professor of Mental Health Nursing here, when I hear you both talk about the clinical placements and about mental health, my pulse rate's gone up. It's very exciting. So when this exhibition leaves Wollongong, leaves the University of Wollongong, it's going to travel Australia?
There is a network of, obviously, a lot of prisons in Australia, not all of them functioning still. But because many were built in the neo-Gothic style, they're often considered to be local landmarks and heritage items. So a lot of them have been saved. And now a number of them have been turned into prison museums. We were at one of the early prison museum network meetings this week, so it's only their second meeting, so we're part of the emergence of it. And part of the point of starting this group was to find ways of interacting and working together. And so there's a great deal of interest in our exhibition travelling through their museums over time. What we decided would be a good process, both helpful for us and very useful for them, would be that our exhibition, we think, captures some of the big themes in the history of prison medical services in New South Wales. But it's not possible at this level to go down into local examples and assess how they differ or slightly modified versions of what we're talking about, or exactly, captured what we're saying. So what we're going to be doing is working with the curators from these prison museums to delve into some of these themes at a very local level. So Kath mentioned one of the issues that we were quite interested in is the appointment of doctors. One of the reasons we were so interested in this was that in the 1830s, so quite early, there was a decision taken that the colonial service, the colonial government, would no longer have direct responsibility for the management of prisons. That was passed over to each individual prison governor. We were a little disappointed to see this because we thought, well, that was the end of the connection between what's happening at the state level and you know, the prison medical service now and the prison medical service in the past, because if it had been devolved down to the local level, then you know that connection was broken. But of course, it didn't happen that way. While the legislation indicated that that's what the intention was, what happened in fact was that the colonial government kept a very strict control over the appointment of medical practitioners to the prisons. So while there were local, in general, what was happening was that there were local medical professionals associated or assigned to a hospital, to a prison. That was done under the auspices of the Colonial Secretary's Department. So it was still very much what we would now think of as the state government, the colonial government's responsibility. So as these were local general practitioners, but there was still a state level of policy, what happened on the ground and what happens in policy, as we know, is not always, they don't always equate. So what we're doing with these prison medical services, prison museums, is to work together to research some of these issues at a local level to see what was happening, to find out whether, for instance, the same kinds of public health practices were being undertaken, to find out how particular prison medical services were operating. I mean, one of the issues that's come up recently is the question of nutrition. One of the first investigations, inquiries into prison medical service, or into the prison medical service, was about the quality of bread being served to prisoners, because the medical practitioner at this particular prison was arguing that you know, if the bread was no good, then everything else was, you know, just a waste of time. We have to get the quality of the bread right. So that's essentially the plan for touring the exhibition, is to tie it into the local stories, to both enrich what we know and also to make it more locally relevant to the visitors.
Real local impact and relevance. Everyone's going to be completely interested in this project, so how can our viewers find out more about it?
Well, the exhibition is open until the 10th of September here in the Panizzi Room at the University of Wollongong Library, and it's open every day, so we'd be really happy if as many people came and had a look at it as they could and wrote some comments, and their contact details in the book that's here. We're also happy to meet people and go through the exhibition with them, giving them a bit of a tour as well. I think the thing is that there's people out there who might have information that they might have an old aunt or an old uncle who might have been a nurse or a doctor or someone who worked in a prison that has a unique insight. And the next phase that we hope to look at is to do some oral histories of people who were involved at a very close level in various prisons in New South Wales, and that's where our local connections with those prison museums can also help too. There's a lot of people who know a lot of things, and if we can get our exhibition out into the regions and rural areas as well, I think we will uncover more things that we haven't got a clue about so far.
On behalf of the Global Challenges program, can I say a very sincere thank you for your experience, your expertise, but the passion that is clearly coming through that you're both exhibiting for this project, and wish you all the best for the future. Thank you so much.
Thank you, Lorna. Thank you.